So if you guys have been diagnosed with shoulder pain that's just general of nature, no specific tearing or anything going on, maybe just impingement syndrome going on in the shoulder, I'm going to show you 3 tips you can do to try to improve your range of motion and decrease your pain. So the first thing we're going to do is a shoulder distraction stretch. This is great for opening up some of the space within the shoulder joint, stretching those structures down deep. This is a really simple stretch that you can do, and you can pretty much do it anywhere that you have a hard surface that's pretty, heavy that you can grab a hold of. So what I'm doing here is I'm just grabbing a hold of this and I'm going to lean away. So I've got my fingers just kind of grabbing on the bottom of the table and I'm leaning away. You can do it in that position. If that's too painful, you can vary the position of your hand. Maybe I grab a hold of it like this and lean away. So basically, I'm just trying to open up and create that stretch down deep within the shoulder joint. And I would hold that somewhere between maybe 15 to 30 seconds, and I'll perform that, for several repetitions, several times a day. Next, we're going to do tabletop slides. So you can do this on top of a table, or you can use a countertop, whatever you have, whatever surface you have that allows you to slide your hand back and forth. You can put a towel or something underneath your hand or a pillowcase to allow this to slide a little better if you need to. So all that I'm going to do is, I'm sitting here next to it. I've got it as far as the height, just kind of whatever you have to work with. I'm going to put my hand here. I'm going to slide my hand forwards. Sometimes people will take their fingers and just kind of crawl or pull or walk their hand forwards. And the farther that I go forwards, I'm going to bend over, lean in, and I'm going to create more of a stretch and open that up. Now, I've shown that in videos before. I like that technique. I know some people do that up and down a wall, and that's fine too. I just think this is a lot better, especially if your shoulder's pretty irritated, everything's pretty inflamed and very painful. It's very difficult to, have to kind of work on stabilization and holding your arm up there. This is just easier just to let it rest on top of a flat surface like that. And then I would do that somewhere between maybe 10 to 15 repetitions for maybe 2 to 3 sets a few times a day. The last thing I'm going to do is we're going to load the tissue. Most commonly the rotator cuff, if it's a rotator cuff issue or it's irritated, the supraspinatus across the top or the posterior cuff, the infraspinatus, the teres minor is most commonly involved. Now there is a 4th rotator cuff muscle known as the subscapularis. That one typically is not as involved, and so we're kind of excluding it a little bit. It is working and firing during this exercise to kind of stabilize the shoulder joint. We're really focusing on that one that runs across the top, that supraspinatus, and the 2 that run across on the back of the shoulder. So I'm going to take one of these exercise bands or resistance bands. There's all types of these that you can use. You want one that allows for you to be able to go through the movement so it's not too heavy. And what I'm going to do is I've got both hands here like this. I'm going to pull this apart. So I'm just pulling that apart like that. And then when I pull that apart, I'm going to bring my arm out to the side. Now, maybe initially when it's very painful, you can only do that a little bit. Maybe you can't pull it apart very far. So just a little bit, if you just pull it, just contract those muscles a little bit. You feel it in the back of your shoulder, and then you bring your arm out to the side. Maybe it's only that far, and that's fine. And you're going to hold that when you bring that out somewhere between 1 to 3 seconds, and you repeat that for 2 sets, maybe 3 sets of 10 to 15 repetitions. And you perform that several times a day. I hope these tips help, guys, to try to reduce your pain that you're having and improve your range of motion of your shoulder and the function of your arm and hand. Thanks for watching.